stress-induced cardiomyopathy or apical ballooning syndrome. Apical means the apex of the left ventricle balloons. And why it does that, I will let you know in a minute. So what happens is that an elderly person or even a younger person, I have seen it, suddenly gets some news or bad news or good news, an overwhelming emotional attack on a person. And try it in your own mind, in your family, friends. Do you remember a person who suddenly got bad news and dropped dead? It has happened in history, it has happened in novels, it has happened in movies, and even in real time. I have known people who had a sudden grief reaction, sudden, even good news. We have heard of people who were told they won a $10 million lottery, and they were so overwhelmed with emotion that either they dropped dead or they went into respiratory arrest or heart failure, rushed to the emergency room. And so the stresses could be anything: sudden illness, surgery, medical procedure, severe pain, domestic violence, asthma attack, bad news, car accident, unexpected loss of a relative, or even a pet. I've reported this case. I've got two cases now of ladies who lost one guy, actually a researcher, another lady who lost their cat. Cat died. Both, they were a very loving cat. For many years she died, and they came to us just last year with heart failure. Fierce argument, financial loss, intense fear, public speaking, etc. So there are any sudden episode where you hear the news can put you into this. And why that happens, we'll let you know. So we don't know the precise cause, but you know well from our physiology that a sudden stress pumps out all the adrenaline from the adrenal gland, activates all the sympathetic nerves, and a sudden surge of epinephrine in the blood is enough to excite the heart. How it does that, we don't know. It's myocardial injury, myocyte injury, coronary spasm causing that. One of the mechanisms is in play, and there was a lot of discussion about that. I don't want to go into details because then it will occupy the whole talk. But just remember that it is excessive sympathetic outburst. It's like flash of lightning. This is flash of spark nikla. That affects the heart. And the heart goes into a stunned state. It cannot beat. Now let's come to why is it called the strange name, and of course it has a relation to Japan. Sato in 1990 described it. Takotsubo is a syndrome called because when they looked at the ventricle, it resembled a fishing pot. I'll show you the pictures of that. It's a fishing pot used by Japanese fishermen, and what they do is they take the fishing pot, put it in ponds or in the rivers, and they catch octopus. When the octopus enters that pot, he has 8 legs, as you remember. He cannot get out. So they catch it, and of course it's a delicacy, and they eat it. They fry it and eat it. So it is named after that pot. Picture of that pot. So this is the EKG that you frequently see in the emergency room. You can notice that in V1, V2, V3 there is ST elevation. Even in the inferior leads there is ST elevation. This kind of EKG, which even in other countries, in America, as soon as the patient hits the ER, the first thing, if he's complaining of chest pain or shortness of breath, EKG. Even in the ambulance people do the EKG, radio it to the ER doctor. If I am on call, he will text it to me. Dr. Karim, there is a patient coming in with ST elevation, get ready, and I will start running. Because within 20 minutes I have to be in the cath lab to deal with this patient. This is called ST elevation, myocardial infarction. But surprisingly, sometimes we find that this same patient who we thought would have a blocked LAD, left atrial descending, turns out to have a syndrome. So it can present just like an acute MI. Another EKG of the same type, ST elevation and T wave inversion. Another EKG. So you do the angiogram, totally normal. There's nothing wrong with it. Right coronary artery, left coronary artery, both normal. So I have no role to play as far as putting a stent is concerned. We close the case, but we do the ventriculogram. Ventriculogram gives you the diagnosis because we are not happy that the EKG was so bad Why would the coronaries be normal? So now look at the ventriculogram. This is the base of the heart, and that's the apex. Apex has ballooned out, resembles this pot. So this is the Takotsubo pot. That's the ventricle of the patient. So as soon as you see that, it is a dramatic appearance. Ejection fraction will be about 30%. Normal is 65, 70%. Then the EZF ejection fraction becomes very low. Thanks. So when you see that, you know that something dramatic has happened.
Will you?
That's a year.
Here's the button. No.